our second presenter and second place honorary is Chiratidzo Munemo from Zimbabwe. She's a PhD candidate at the Women's University in Africa in Zimbabwe. She's working on a precision nutrition bundle for pediatric cancer care, a personalized intervention addressing nutritional deficits at Pediatric Hospital in Zimbabwe. Chiratidzo, you can go ahead and share your slides.
Thank you, Bessie. Let me just share my screen.
Yeah, just remember to share your screen when you are clicking share, so that you then present your slides. On screen sharing, remember to click share screen.
Is it showing?
Yeah, we are showing. You just need to go into full presentation mode. Yeah, okay, perfect. Okay. Yeah, you can see. You can go ahead, Chiratidzo. Remember, you've got 8 minutes.
All right. Thank you very much, Bessie. Good evening, good morning, good afternoon, everyone. My name is Chiratidzo Munemo from Zimbabwe. I am from the Women's University in Africa. I'm a PhD student, and I'm in the early stages of my study. And I'm looking at an integrated personalized nutrition support bundle, a step towards precision oncology addressing nutritional deficits in pediatric cancer patients. So just to jump into the background of my study. So like pediatric cancer patients face significant nutritional challenges during their treatments. This is from the physiology of cancer itself, how it affects the body, and the demands that it brings to the body, as well as the treatment modalities that are used, be it radiation therapy, be it chemotherapy, be it surgery, or other therapies that are being used. All of them, they still culminate to reducing nutrition uptake to our pediatric cancer patients. Nutrition actually affects treatment outcomes, the quality of life, and a long-term health effects to our pediatric cancer children. When we define the pediatric cancer pediatric patients, we are looking at children from the age of 0 to 18 years. But for this particular study, I'll be looking at children from the age of 6 months to 12 years. Why I've chosen the age group is because in Zimbabwe, we also have a policy that says strict breastfeeding for the first 6 months of life, which means we cannot intervene with any other artificial feeds. So during this time, we are giving our children only milk. So I chose the population from 6 months to 12 years. Then current nutrition support strategies often fail to address nutritional backgrounds. So when you look at what we are currently doing in Zimbabwe, we still have large numbers of children who are suffering from malnutrition during their cancer treatment, which means the current strategies that addresses malnutrition are not really giving us the results, which becomes one of the objective of this study. Looking at the problem statement, so inadequate proactive nutrition strategies. Like I said, we do not have anything in place that is addressing malnutrition before it occurs. Since literature actually tells us that we are likely to have malnutrition in our children, but we do not have anything in place to combat this or to prevent it from happening. There are high prevalence of malnutrition amongst our pediatric cancer patients, poor health outcomes, which are manifested as high mortality rates and poor quality of life. There's lack of systematic approach, whereby we have fragmented approach to management of malnutrition in cancer patients. This is actually shown by high mortality rates, high prevalence. There's limited data integration. Like I said, there's fragmented care. Then there's unstandardized care, whereby individuals from different institutions use their different approaches to manage malnutrition in pediatric cancer patients. So this study aims to answer the questions: what are the specific nutritional needs for pediatric cancer patients? Can a personalized nutrition support bundle improve the nutritional status and the health outcomes amongst this population? What are the optimal nutrient delivery strategies that can minimize interactions and toxicity during treatment of cancer? So the objectives of the study is to explore and categorize nutritional needs of pediatric cancer patients, develop and validate a personalized nutrition support algorithm, which is a bundle, evaluate the efficacy and safety of personalized nutrition support. So this study is going to take a pragmatism lens. It will employ mixed methods approach, whereby qualitative data is going to be collected and analyzed. This data include the family experience regarding cancer and malnutrition. Quantitative data is also going to be collected and be analyzed, and this includes biometric data that is going to be collected from their patients. The study is going to adopt a conceptual framework from GLOW. We have upgraded the input, process, output, outcome feedback conceptual framework, which was originally started in 2016, and it has been upgraded to bring the components of feedback and outcome. So the inputs in this instance will include the nutritional interventions, patient characteristics, which we are going to obtain from investigations and the biometric data. Processes will include the healthcare services that are going to be implemented as the clients or the patients are going to be visiting the hospital, and the other support system that includes the counseling, the laboratory services, and also the financial services. The outputs will include the patient's outcome, nutritional status, and that's the outputs, and the outcomes will be reduced nutritional deficits and improved health outcomes. Feedbacks will come through continuous monitoring and evaluation and adjustment that will be made as we will be testing the bundle. So the significance of this study is to improve health outcomes and quality of life for pediatric cancer patients. We also want to enhance patient satisfaction through a qualitative approach, then contribution to development of an evidence-based personalized nutrition support that will address the actual needs of individual patients. So the expected outcome, as mentioned, improved nutritional status, enhanced quality of life, and development of a personalized nutrition support algorithm or bundle. Thank you. Any questions?
Thank you so much, Chiratidzo. Wow, that's very interesting. Personalized nutrition. Very, very interesting indeed. Any questions from the audience? We have 2 minutes, so we'll get 2 questions for Chiratidzo. Any question from the audience? I've got Augustine's hand is up. Please go ahead.
Yes, thank you. Thanks to the presenter for that wonderful presentation and the previous presenter. My question is, were you able to do a research to determine the number of persons who are currently experiencing cancer in line with your research?
May I please come again?
Okay. I think your research is focusing on some group of people who have experienced cancer. From my point, it appears like not too many people. In your hospital where you conducting your research, are there too many people who are experiencing cancer and they fit in your research targets?
Okay, so from the statistics that are not published that I got from the pediatric oncology department, where they admit children from the age of 0 to 12 years, I've realized that they have bed stat of 35 plus almost at every given time, which means they've got 35 patients with cancer. Then I also checked their monthly returns and their new logbook, their logbook for new clients, which actually shows that they are enrolling at an average of about 15 new cancer patients every month, which means we actually have a surge. I also visited our registry, our cancer registry, which actually showed due to the increased case finding that has been introduced for cancer, we have actually seen that we are now experiencing increased numbers of pediatric cancer patients than in the previous years.
Okay,
Okay.
thank you.
Just a follow up to that. Why you agree that these numbers just keep increasing? Have you been able to first find the solution to it? Why is it that people keep experiencing that condition? Why are they coming down with cancer? Because we just find a solution? Can we stop people from getting it instead of working towards finding solution to the kids and things? Is there a reason for which the number is increasing?
Okay, like I said, the increase in the number has been currently attributed to the increased case finding. Like there was training of nurses on identifying cases from grassroots. We actually decentralized our oncology and palliative care nurses to rural areas where they are actually getting these patients, unlike the previous years, where the children will be treated for other conditions until maybe we lose them before they are diagnosed.
Okay, thank you. It's over to you, moderator.
Oh, sorry. Yeah, that's a very interesting question from Augustine, and also some very interesting responses from Chiratidzo. Thank you so much. Just a quick comment. I think when you suddenly see increase in the prevalence of disease, that is also related to when you increase the screening process. That also like projects like as a surge in a disease, whereas it's just that now you are picking cases because you are now screening. Yeah, that's I think that's a comment from me. My quick question was, why are you looking at biometric data for nutrition? What is what in terms of biometric data, what exactly are you looking at?
Okay, so I'll be screening like the protein serum levels. We're also going to do the MOAC. We're also going to do a bit of genetic profiling for microbiome, for gut microbiome, because some of the cancer treatments are delivered through oral, and also other treatments, they actually have an impact to the gut system. For example, the radiotherapy. So at the end of the day, we have them, they are suffering from gut problems. They've got indigestion, they've got poor absorption syndromes.
Okay, no, that's fine. I think it's your use of the term biometric data, because biometric data would refer to something maybe like there is physiological biometrics, and then there's behavioral biometrics, and
Okay.
yeah. So I think it's your use of the term. Is the data, the data you want to collect, I think is okay, but it's the use of the term biometric
Noted.
data.
Thank you.
Yeah. Okay, all right. Thank you so much, Chiratidzo. That's very interesting, a very interesting project.